Good afternoon, everyone. Welcome to the call. My name is Carrie Craven. I'm an administrative specialist for KCMPA, and we thank you for your time today to be with us for this webinar. First off, I'd ask that while the webinar is in progress, if you would please mute your phone line so that everyone can clearly hear the presentation. You can press *6 on your landline phone to mute, or if you're on a cell phone, just hit that mute button on your call screen. If you have a question during the presentation, you can ask it via the chat window in the GoToMeeting dashboard, and we will get to it at the end, or you may ask it when we open the lines for Q&A. So joining me today is Cindy Campbell, who is the Director of Clinical Strategies for KCMPA. And Cindy is going to share with us about the Huddle today. Cindy, go ahead.
Great, thanks, Carrie. So I just want to thank everyone joining today for KCMPA's monthly webinar series. And as you can see, I have a slide that shows the topics for the upcoming months for the rest of the year. So if that's something that you're interested in hearing about, please take the time to join us. We would love to have you. So today we're going to be talking about the Huddle. Some of the basics that we're going to be talking about is really the what, why, and how. We're going to talk about the Huddle agenda, and then we're going to see a Huddle example. And then I'm going to share with you Huddle videos. It's a series of different videos, just links, so that you can, watch that on your own time, and maybe it's something that you want to share with your staff as well. So before we get started, you might be thinking and asking yourself, why the Huddle? For some of those of you that know about the Huddle or have knowledge of patient-centered medical home, the patient-centered medical home model, you know that the Huddle is really a core concept. It's one of those, pieces of team-based care and communication that is a pretty core concept. It's the low-hanging fruit. It's a just do it. But we thought we'd use this forum as a refresher just for some of those kind of basic core concepts that we all have learned about, we all know about, or we may not know about. Just more as a refresher, and just kind of take some time to look back and I'd encourage you all to review your own processes, around the Huddle, and if you are doing it at this point in time, and just think about a couple of things such as, is it going well? Do you need to tweak it? Is there anything that you need to do better? Did they kind of fall by the wayside? Do we need to get them restarted? Are they getting kind of dry and we need to, kind of get them spruced up a little bit? Or are you still in the process of just trying different ways? So there's a lot of different things to think about, after this presentation today that I'd like for you to be able to take back with you. So first of all, what is a Huddle? And just very, very briefly, it is a very brief meeting. It should be no more than 10 minutes. The typical time should be 7 minutes, but it's a time when, or in a meeting when the care team is meeting to plan production and their care delivery for the day. So everybody can just kind of meet and get organized. So why do we want to Huddle? What's the point of it? Well, it allows for the practice to plan for any changes or anything that might happen in the daily workflow that could easily be predictable if we had looked at the schedule or looked at our day and then made adjustments and managed any crisis. Because that's the main point. We want to look at the schedule, we want to look at our day, and we want to anticipate where a potential crisis might occur or a backlog, and how do we keep that from happening? How can we be proactive? You want to identify those potential bottlenecks And we'll talk about a little bit later about what those bottlenecks might be. And it helps you to allow to make adjustments early in the day before you get to that place where, oh, wow, now we're backed up, we're in a backlog. You know, if we had done this earlier in the day, we wouldn't be in this situation, or we could have prevented this. So it will help allow for those adjustments to take place early in the day. And it'll help to talk about roles and responsibilities. Who's going to be doing what? And the team could be talking about identifying the working to the top of your license. Is everyone doing what they should be doing, that they are qualified to be doing? And it helps to eliminate assumptions. How many times in a day do we just assume that someone else has been taking care of something that needs to be taken care of? That nobody ever really talked about it. They just assume that it's being taken care of. And then at the end of the day, or when it's needed, or whatever the situation might be, it hasn't been done. So it will help allow to eliminate any of those assumptions because it's discussed early and everyone knows who's going to be doing what. But I think the most important thing about a huddle is that it starts to change the mindset of the practice staff so that they start thinking like a team. They start communicating with each other and they start developing a team. So how do you huddle? Now we want to do a huddle, but how do we do it? So these are some really core concepts, just some basic how-tos. You're going to find that you may need to make some adjustments to make it work in your practice. There's times when people come in at different times through the day. There's different factors that might have to, create the situation where you have to be a little bit more flexible and you have to do some adjustments. But that's common. That happens. But just as long as you keep in mind some of these very basic how-tos, and then how the huddle and some of those adjustments, you need to do it however it's going to work best for your practice and for the team. So limiting your huddles to at least 7 minutes or less. So it should never go over, at least a 10-minute time frame. These are very quick. You get down to what you need to talk about. Holding the huddle in a very central location, and everybody should be standing instead of sitting. Sometimes when you're sitting, and especially if this is early in the morning and you have your coffee, and it's kind of easy to start talking and to sit there a little bit longer. But these are really quick. You want to make this quick. If you want people to discuss what they need to discuss and then be up and on their way. Choose a consistent time on a daily basis. That way everyone knows, everyone on the team knows this is when we meet and this is where we go. Experiment with some different times of the day and attendance. So that means that, if you have your different team members come in at different times, it might not work out for you to just do it first thing in the morning. But once again, experiment. Try to figure out how it works best for your practice. And another piece of that is sometimes not everyone can get in on the huddle. So you might think about having someone who is maybe a lead or someone who can take information back from a huddle back to the rest of the team. So just once again, different ways to do the huddle. Physician support. Having physician support, and whether they're in attendance or not, is really key. If the physicians don't support it and don't say, this needs to be done, they lead. And a lot of times you'll find that the rest of the care team isn't going to really follow through. They won't see the importance of it unless the physicians and the providers are supportive of it. Consider involving your entire care team, the receptionist, your MAs, nursing, your care coordinators, the providers. A lot of times they can provide information, your receptionist can provide information about patients that the rest of the team may not know. So consider the entire care team if it can work out for your practice. So for some of you that are not yet doing huddles, but you want to get there, think about in the beginning having a designated person that kind of gets everybody together and leads the huddle at the beginning of each day. They have the agenda, and they're kind of the ones that get it up and going. And I guarantee after a few weeks, it's going to just run itself. I have many, many experiences of people that when their huddles first started, oh, it was just, we don't have time for this. It was just something else they felt they had to do. And then within 4 weeks, they could not live without it. They could not even imagine not having the huddle every day. And it just requires daily discipline and, once again, a champion. So whoever it is that's your designated leader, that they champion this and they get everyone else involved. So the huddle agenda. So what do you talk about? Well, there's a lot of things that you talk about. And sometimes you probably are doing these things kind of in silos and, as you just kind of pass each other through the day. But bringing it to the huddle and to the team, you can really make sure that information is passed through for everyone. So things to talk about, just looking at your schedule, looking at those patients that might need more time and assistance, those patients that maybe need a little bit more social time. They like to talk, or that they always have a family member that comes with them that asks a lot of questions. You all know those patients. You have them every single day, and this is a time to allow for those patients. Checking for back-to-back lengthy appointments. And what can we do to make sure that we can cut those down to the shortest time possible? Looking at once again, looking at your tasks and who is doing what. And is everyone working to the top of their license during those appointments? Looking at if there's any open slots that can be filled. Considering who is on your schedule that's a chronic no-show or chronically late patient. What can we do? Can we call those patients just as a reminder? Hey, Mr. Smith, the last 3 times you've had an appointment, you haven't shown up. We want to make sure that you're going to be here. Or, hey, Mr. Smith, the last 2 times you've been 45 minutes late to your appointment. We just want to make sure that you understand the time that you need to be here. And do you have transportation? Do you have a way to get here? Do I need to call a family member for you? Any special instructions? So just anything that everyone needs to know around special instructions for the day. Looking at the provider and the staff schedule. Does anybody need to leave early? Does anybody need to attend meetings? Are there important calls that you're waiting for? So these are the kind of things that you don't want it to be a surprise, at the end of the day. Oh, hey, I needed to leave an hour early. Oh, I forgot to tell anyone. So this is the time when everyone can talk about what they have on their agenda and they can make those appropriate adjustments. And this is going to be a really important piece. Having lab results, any test results, discharge notes, anything, notes from referrals from specialists that the patient may have gone to. Are these all ready to go? They're on the patient's record, and they can be reviewed, prior to the patient coming in. This is all about the planned visit. The provider can't really make good decisions unless they have all of the information, and this is helping us to have all the information. Plus, having all of that on the chart beforehand, it helps to keep any delays from happening by trying to find all of those things later on. Oh, it's in somebody's email or somebody's inbox somewhere and it didn't get put into the record yet. Sometimes that takes a little time. So, there we go with something else that takes up time. So having those ready beforehand. So I'm going to stop here for a moment, and I'm going to show it's a YouTube video of a Huddle example. And this is one of the best examples that I have ever seen. And I just thought I would take a minute. It's only 3 minutes long, which I think is great because it shows you how much information can be covered in such a short time. We were having a little bit of difficulty with the audio, but I think we've got it fixed. But if anybody can't hear it, if you could just please speak up.
Good morning. If we could have everyone here for the huddle. Good morning, everyone.
Can everyone hear that?
Yes. Except now I can't.
And how many add-on patients we had.
Can you now?
How many were in the walk-in, and how long it took to
Yes.
answer the phones. And we talked also about what's happening today. Which doctors are working with which staff, who had availability to add patients, if any meetings or anything else going on through the day.
Our nurses today are Amy and Kim. We have Dr. Laughlin in the walk-in clinic with Sharon in the morning and Lauren as our nurse. Today we're looking at a pretty busy day, a full day already. We're starting today at 48% with Dr. Isle, 100% with Dr. Salazar, 96% with Dr. Way, 100% with Paige McClincy, and it looks like we had a busy day yesterday, 35 patients in the walk-in clinic and a total of 128 patients in the building. We added on 15 total patients yesterday. For reception, it's very helpful. I use it all day long. Knowing which doctors are here is very helpful, knowing who's working with them, which MAs, which nurses are here. Because we switch around a lot here, it's helpful to know where everyone's at for the day. It's also very helpful to know who's in the walk-in and who's working there, and all that information is there for you. I also use the percentage for booking. It tells you how many patients are already booked on the doctor's schedule and where you have room to work people in if you need to. Yesterday, we had 233 calls with a 5.58% abandonment rate, still well below our 10% abandonment rate goal. And we had a 27-second average speed to answer yesterday underneath our 45-second goal.
We chose ourselves what things we wanted to measure regularly, and they're linked to what we want to be doing as a satellite, as a group. We've seen improvement
This morning,
accumulated to this process in areas that had been pretty intractable for a long time.
an ACT meeting today from 1 to 2, and tomorrow, which is Thursday, they will be completing our installation of Outlook 2007, and Ellen Baker will be here tomorrow morning to explain to people how to use it. That's all. Any other announcements today? No. Everyone is ready to talk. All right. Have a good day. Thank you.
Okay, so if you noticed there, I know it was I liked it when they said Outlook 2007, so it's a little bit of an older video, but the concepts are still just right on. They had, and it was no more than 3 minutes, and I love the way that they also brought in looking at some QI measures as a way to share how they're doing. So just kind of taking a look at yourselves and in your clinic and just some considerations, you know, how are huddles done in your clinic? Are they working for you? Are they efficient? Are they being done? And do you feel like it's something that you can, that can be enhanced? Or do you feel like it's something that now we've started this, we can live without? So just some questions just kind of posed for you to think about and maybe take back to your practice. So I have included several videos here on the Huddle, and I think on here as well I have some an example of a Huddle form, so that when you're first starting your Huddles, if you want to keep track of and use an agenda and kind of to keep track of what you're discussing, a lot of places like to do that, and then they keep those for about 3 months, and it just is a way for when they do their NCQA to be able to show documentation that they are actually doing a Huddle. Have some resources here additionally that you might be interested in, and that is it, and that ends the webinar for today. Does anybody have any questions? All right, well, if there are no questions, then I want to thank everyone for coming today, and this will be available. Carrie, where we put this? We'll put it out on the YouTube video.
Yes, these are put out on our YouTube channel, KCMPA. If you search us, we have all of our webinars from the past on there, as well as some other training videos. And I'm going to see if I can upload all those Huddle videos as well.
Great. All right, well, thank you, everyone. Have a good rest of the week.